Okay, good morning everyone. Thank you very much for taking the time to join us in the very first Aboriginal Eye Health Forum, hopefully the first of many to come. And before I start, obviously we begin by acknowledgement of the country and that we pay respect to the elders past and present, and to our Aboriginal colleagues that are present in the room as well. And it was and always will be Aboriginal land, and it's wonderful to have so many advocates for Indigenous eye health present today as well. So before we sort of kick off the presentation, I just wanted to say a few words about the advisory group. Then we'll have Walter do the welcome to country, and then we'll start the day. So the advisory group for Indigenous eye health in Western Australia was re-established in 2020 to provide a platform that supports all key stakeholders to work collaboratively in the delivery of eye health services across WA. The purpose of the advisory group is to facilitate a consistent approach to the planning, coordination and funding of sustainable evidence-based health services to Western Australians with a focus on improving eye health of Aboriginal communities. The advisory group builds upon the University of Melbourne's roadmap, and we've got Mitchell Andrew present here today as well, and the amazing work that's been done in the West, in the West soon, but in the East they've done some amazing work that we can build on. The roadmap to close the gap for vision and acknowledging that successful eye health outcomes involve the coordination of both eye health services and patient journey on the eye health pathway. And we have representatives from local, sort of the Department of Health in WA, federal government, Lions Outback Vision. We've got Angus Turner present here as well today, and a few other advocates and champions for Indigenous eye health in the state. So some housekeeping notes before we start. Toilets are just outside the door. In case of emergency, please follow the instructions of the fire warden. Please note that the muster point is at the parking in front of the building, and breaks will be held in the foyer, so just outside where you came in to do your registration. Mobile phones, if you can please put them on silent when you're attending the session, that will be much appreciated. The sessions will be recorded. When it comes to ask questions, please ensure you speak clearly into the microphones that will be handed to you by the Rural Health West staff members. And we'll have a photographer who will be going around taking some lovely pictures. Please let them know if you would prefer not to be photographed as well. There will be a post-event evaluation. This is, as I said, the first WA Aboriginal Eye Health Forum, hopefully the first of few thousand to come. And this service would allow us to plan them better in the future. So if you could please respond to the survey when you receive that, that will be much appreciated. So without more to do, I would welcome Walter. So Walter McGuire is a Wajak Noongar mam, and I think that's how you pronounced it, mam. Where is Walter? Yeah, there he is. And he's the owner and operator of Go Cultural. If we can please have the website up. With his wife, Meg. As a proud descendant of several Bibliomon tribe clans of the southwest of WA, Walter continues telling the first story of Aboriginal people to the local, interstate and international visitors to Perth from all over the world. And I look forward to hearing your welcome to country. Walter.